I'm Dr. Kabir. I'm the endocrinologist at Hamilton Diabetes and Endocrinology Center. I feel like I've known all my life. I'm the youngest in my family, so I don't really have too many people asking me for advice or questions. Until I found medicine, until I started, volunteering through high school and just working with patients and enjoying that so much. And the fact that I made a difference in someone else's life, I think that's when I knew I wanted to be in medicine. So endocrinology is really complex. It's kind of the thinking part of medicine. So you have to really enjoy it to want to do it every day. I love the difference that we can make by just adjusting, certain levels or certain medicines in someone's life, and the impact that the patient notes or tells me about, or the progress that I see. Through med school, I went to an army medical school overseas. I had been volunteering in Bangladesh, and I had relatives who were physicians in the army. So we worked closely with them through camps, and that's where I decided to go to medical school so I could continue working and continue in med school at the time. After med school, we started working with a couple of international organizations to set up these camps, so these refugee camps and these Rohingya camps. And that's where I first met American trained physicians. And their kind of problem-solving ability and their training and their protocols or way of doing things is kind of what led me down this path to move back to residency here in the States. Working through residency here at Hamilton Medical Center, you train to be a better physician yourself. You have exposure to all of these complex endocrine cases. And I think it's made me a really strong physician. Again, with the problems that you have to solve through training and all of that, and having these wonderful mentors guide you through all of that, it makes you an amazing physician. And then through residency, through fellowship, I think one thing that's always been resonant in me is always to give back to the community. Endocrinology is a study of diabetes, hormones, and metabolism. There's many, many different fields to endocrinology. So there's diabetes, there's thyroid, there's bone. I love to practice in obesity medicine, glucose and its metabolism. I've been trained in bone. I love general endocrinology, but the biggest thing I think I bring to this community and the table is I've always treated each patient as more than just a patient, as a person and as an individual. And just learning their story and where they come from, I think my goal is usually to find a way to make their disease state a little bit easier for them to carry. So that's what I usually try to do with my patients. I love getting up in the morning, seeing my patients. Clinic I think has always been one of my favorite places to be. I love the dynamic when we walk into your office, starting from your nurses to when you enter the doctor's room. I love it. I enjoy being there. And I want my patients to feel that energy as they walk through. Particularly diabetes and endocrinology. I spent a lot of time there through residency because I knew I wanted to do endocrine early on. So the educators, the nurses, everyone is just working together to make the environment and make that clinic an amazing experience. So I enjoyed being a physician there. I enjoyed being a resident there, and I know that I can give the patients the same experience because I enjoy it. I changed a life. I made someone's day better. I made someone's load a little bit easier to carry. I think it's tough. I think I deal with a lot of complex disease states. And when my patients come to me, they're worried about it, or it's a problem that no one has been able to solve and no one has been able to help them. And I think it comes down to listening to them a little bit better. Each person is different. Their circumstances at home are different. They have certain things that they can do, certain things that they're comfortable with. And I think just having a patient population that I can see the difference that I've made. If I follow them over time and I can see where they started and where they've come from, and then where they're going, where they're headed, I think that's the biggest thing for me.